So I had heard many stories about women, especially women of color, and I mean men too. A lot of people in my age group and people in their 30s and 20s are, just suddenly dying of strokes and heart attacks and I was always wondering, like, how does that happen? How does something like that sneak up on you? Well, one night I was extremely tired. I was having serious dizzy spells. I mean, the room was just spinning. It was frightening. Where, if you're dizzy, you sit down and the room will stop spinning. Well, the room was getting worse. It was really spinning as I sat down. So there was no relief from the dizziness. And then the headaches were just unbearable. I mean, I was in a fetal position. It was so bad. And I never once thought to check my blood pressure because I always had low to normal blood pressure all my life. One night, it was just a very, very scary night. And my mother saw me and she was like, you don't look well. I think we should take you to the hospital. And I'm thinking, oh no, I'm fine. I just need some rest. I'll be all right. And the pain, the migraine just got unbearable, and the dizziness, I couldn't take it anymore. I went to the hospital, I went to the ER room, and my blood pressure was through the roof. When they say that kind of stuff will sneak up on you, it can sneak up on you. So when your body is talking to you, you definitely need to listen. And the emergency room, the doctors were, they were awesome, they were amazing. They helped me manage the pain. They gave me something that they called a headache cocktail, and the pain went away instantly. I mean, I felt the medication just going through me, and I was out like a light. My mother was like, you slept so peaceful, because I hadn't been sleeping. And they said, you need to get in touch with your regular physician and talk about this high blood pressure. You need to manage that, and the migraines and, other things. And I knew the moment that they said that, I knew I was going to end up on blood pressure medication probably for the rest of my life, because I know of people, who started with some high blood pressure and they got prescribed some medication, and then they had to change the dosage on that, and then they had to take a different high blood pressure medication because this one was affecting their kidney, and now they got to take a different one, and next thing you know, they're on 4 or 5 different blood pressure medications. And I said, I can't live like that. I just can't. So I wanted to find an alternative way, and I heard about Dr. Mendez and Complete Chiropractic and Rehab, and I was like, I need another way. I'm trying to be around for a while longer, and I do not want to be drugged out and worried about kidneys and liver and everything, from blood pressure medication.
So you're
that can
looking
happen.
for the cause.
I'm looking for the cause, like what's causing the migraines. Yes.
Absolutely, absolutely.
Yes.
Meleika initially presented in the office with cephalgia and also lumbago and neurologic claudication going down into her legs. The common term for that is headache with neck pain, low back pain, and also nerve pain into the legs. Based on Meleika's symptomatology, I quickly employed a cervical and lumbar imaging series to check the alignment of her spine, along with the disc and nerve pressure integrity. Followed it up with extensive range of motion testing with neurologic and orthopedic examinations to identify the true cause of her problems. X-ray findings revealed a hypolordotic curvature to the cervical and lumbar vertebra, which means that her spine is losing their natural curvatures. X-rays also revealed multi-levels of disc degeneration accompanied with nerve compression. My automatic plan of action is to get Meleika on a strict treatment plan to start the correction of her spine. With the various stretching exercises and chiropractic-specific adjustments to the pressured areas of her spine, we were able to start to restore the natural curvature to her neck and her low back, releasing the pressure of her brainstem that was causing her headaches and releasing the pressure to her low back that was causing the pain in her localized low back and pain down her legs.
So since coming to Dr. Mendez here at Complete Chiropractic and Rehab, I mean, Dr. Mendez, you and your team have brought me so much relief. I can't even begin to tell you, because the pain that I was in was just, indescribable. I would come in to get my adjustments and my head would be pounding. I mean, I felt like my brain was bleeding. That's how bad it was. And Dr. Mendez would just take my head and, work his magic, and pain would just be gone.